Hello everyone, my name is Tessa Warner and I recently graduated from the Medical University of South Carolina's Emergency Medicine Residency Program. I'll be talking to you about the clinical and cost effectiveness of Bougienage for esophageal coin management. Children frequently present to the ED for evaluation of ingested foreign bodies, most commonly coins. If lodged in the esophagus, coins can cause significant morbidity and warrant urgent removal. Most commonly, this is done via direct visualization in the operating room or endoscopy. Esophageal bougienage is an alternative technique that has previously shown to be safe and efficacious with reduced length of stay and cost. But despite these advantages, this technique remains underutilized. Here's an example of the esophageal bougienage procedure. On the right, we see an example of the bougie or Hurst dilator, as well as the size listed according to age. The child is gently restrained by a member of the medical team by sitting behind the child with a hand over the forehead and arm across the chest. Another assistant will help hold a bite block. You can see a white piece of tape on the bougie, and this length was measured by measuring from mouth to the ear, specifically the tragus, to the xiphoid process. Gel is placed at the end of the bougie, and the bougie will be inserted until the white tape mark is reached and then quickly withdrawn. The actual insertion only takes about 5 to 10 seconds. A repeat x-ray is then performed to confirm that the coin has passed into the stomach. Our study was a retrospective case series of children with esophageal coins presenting to our tertiary care pediatric emergency department between November 2012 and December 2018. Eligibility criteria for Bougienage included age greater than a year, absence of respiratory distress, absence of prior gastroesophageal surgery or disease. It had to be a single coin ingestion, and it had to be a witness ingestion within 24 hours. The data we abstracted included age, weight, presenting symptoms, coin type, management, complications, length of stay, hospital charges, and return visits. Our primary outcomes included procedural success and complications, and secondary outcomes included length of stay and hospital charges. Here are our results. On the left, we see a bougie success rate of 97% and a success rate of 100% for OR or endoscopy. On the right, we see this broken down into a pie chart. Bougienage was successful after a single attempt in 140 patients. It was successful after 2 attempts in 3 patients. 53 patients went to the OR or endoscopy prior to any bougie attempts. There were 2 patients that went to the OR or endoscopy after 1 failed bougie attempt, and there was 1 patient who went to OR or endoscopy after 2 failed bougie attempts. The other includes a child who left AMA with his family for treatment at another facility, and it also includes a patient who had attempted Bougienage in the ED and had actually passed the coin spontaneously prior to needing any further intervention in the OR or endoscopy, and then 4 passed with spontaneous passage. The median age for our population was between 3 and 4 years old, but the median for operative removal was lower than for Bougienage. The coin type was mainly pennies. The coin location was typically in the upper esophagus. Here we see that the total length of stay was significantly shorter for Bougienage compared to operative removal. The ED length of stay was also significantly shorter for Bougienage compared to operative removal. Hospital charges were significantly less for Bougienage compared to operative. And as far as complications, there were 8 minor complications for Bougienage, and these included mainly things like vomiting. There were no major complications for Bougienage, and for operative removal, the minor complications included things like stridor, and the major complication included a need for reintubation. There were also repeat visits for Bougienage, but these were mainly for minor problems such as some abdominal pain. Here's a review of the literature. So our study is listed first, and that shows a success rate of 97%. These other studies show similar success rates. They also showed no major complications for bougie. The majority of them also showed a statistically significant cost difference, being much less cost for bougie compared to endoscopy or OR, and they also showed a statistically significant length of stay difference. being much shorter for the bougie compared to endoscopy or OR. In conclusion, esophageal bougienage is a safe and effective strategy for esophageal coin management. It also significantly reduces length of stay and hospital charges compared to OR or endoscopy retrieval. Our next steps include a survey of EM and PEM providers across multiple academic and community settings to evaluate use and barriers to use of the Bougienage technique. Preliminary results from our survey development process have shown that the procedure is underutilized in not only the community settings, but also academic settings. A total of 25 institutions, including academic and community, pediatric, and general emergency departments across 17 states, have been included in our survey development so far, and only 2 of these institutions have reported the use of this technique. Here are my resources. Thank you.